Let's talk genetic testing. In the past, we've used data from Ancestry.com and 23andMe when our patients have gotten the genetic testing done through them, where then you could get the raw data and run it through NutraHacker. And this still is a good option to be able to look at many of the different SNPs that we like to treat and that we deal with in our clinics. But I have a much more elegant option for you. And that's the MaxGen The Works test that we offer right through Dan Purser MD. We've recently redeveloped that panel to cover all of the SNPs that we really deal with, the ones that we feel that we are most capable of treating and offering really good solutions to, including this test covers 15 of the 17 known homocysteine SNPs. That means if you have any of these SNPs, homozygous in any of these SNPs, that you're going to have an overabundance of homocysteine in your body. And this causes bad inflammation by raising cytokines throughout your body, pro-inflammatory molecules. So if you happen to have any of these homocysteine SNPs, you're not going to have a good time. You're going to be in a lot of pain and not very happy. And the risk of heart attack and stroke are greatly increased. But there's something we can do to help get around that. So first of all, get the genetic testing so you can see if you have these issues, as well as many other SNPs, including MTHFR and other methylation SNPs, many other very important SNPs that we'll get into in another video. But with the homocysteine, as you've seen Dr. Purser and I talk about in the past, the pathway of taking methionine into homocysteine into glutathione, the transsulfuration pathway, is disrupted if you have these gene SNPs and if you have the deficiencies caused by these gene SNPs. So our way of treatment, instead of doing a low methionine diet to lower homocysteine levels, we deal with the fixed homocysteine levels by introducing lots of exogenous glutathione to the system. That means taking a validated and reduced, absorbable and stable version of glutathione to help protect your body against the overactivity of homocysteine and the cytokines it produces. That's called hyperhomocysteinemia. So introduce a ton of reduced glutathione to the system, and homocysteine levels, even though they may be fixed, the cytokine levels that are produced lower. You finally get in control of it. You get ahead of it. That's the beauty of varoglutathione providing this amazing benefit. So look at that genetic testing. See if you have any of these gene SNPs, and then make sure to be taking your varoglutathione. That's the number one thing we instruct every single one of our patients. It's the best thing you can be doing for yourself now and for the future. Take care.